Welcome back to Healthcare Consumerism Radio. This is Brent Macy and Doug Field here with the next segment of Healthcare Consumerism Radio. And joining us is Alissa Gavrilescu from Solstice Marketplace. Welcome, Alissa.
Welcome, and thanks for getting my name right. That's pretty impressive.
Oh,
he did good, didn't he?
I worked all morning trying to make sure I got that right. But welcome to the program. And I know, we just had Terry McCorvey on with Allegis Technologies in the private exchange market, and you guys are in the private exchange market, and it's big business and a hot topic. Kind of give our audience kind of a feel for, who Solstice is, and we'll dig a little deeper in the segment.
Great. Well, I'm certainly excited to be here. Solstice, we started as a dental and vision ancillary benefits insurance company. And, due to the emergence of healthcare reform, we certainly saw the benefit of providing a marketplace and a private exchange for our customers, both on the broker and on the group side. Mm-hmm. We created our private exchange, which is called the Solstice Marketplace, earlier this year, and we rolled it out at Sherm and Nehu a couple of months ago, and we're excited to see the feedback, for the features and the tools that we've built. It's pretty exciting.
Hey, Alissa, this is Doug, and good morning to you. What is your model? What is your exchange model? Tell us a little bit more about that.
Well, our exchange was originally created to be broker-centric. We've seen a lot of exchanges that touch on the group or employer needs, but we really created ours to be focused on the broker, to understand their business, and to help keep them competitive throughout healthcare reform, and to create value for them with their clients.
Now, in the last segment, also we had Terry talk about the brokers and some of the things that they were doing with brokers. For the brokers that you talk to, what is their appetite for having a private exchange offering that they can then turn to their employer clients and offer?
We were really shocked at how receptive the brokers were to the product. Ours is unique in the sense that it does provide the brokers the opportunity to co-brand it and to make it their own, as well as providing a lot of really cool tools for the groups and the employers, educational material and items to really help the clients through the enrollment process. So they really were receptive to that model and the fact that it really spoke to both the brokers and to the employers' needs.
Alissa, is it a group and or individual product model?
It sure is. The brokers have the ability to upload their groups, their carriers, and their plans to the system. From there, they upload their clients and create an open enrollment process. The clients then have open enrollment for all their benefits. There's a cost calculator, educational tools, and all the things that the employers and the employees will need to conduct their open enrollment.
Alissa, you obviously are coming at this from the ancillary supplemental health background. So, I'm going to make an assumption with the statement. So you truly see the well-rounded experience that brokers need to supply to their employers, going beyond major medical to include those supplemental health choices, correct?
Absolutely. We really feel that way. It's not just about medical anymore. We really feel now throughout healthcare reform that ancillary benefits do, create an additional competitive advantage for brokers, and that having a well-rounded product portfolio for the brokers is really important for your clients.
Now, with that, Alissa, with the well-rounded, options in there, is that one of the things that if I'm an employer or if I'm a broker who's looking to represent a certain exchange, is that what I'm looking for? Am I looking for what's the most robust option out there, or am I looking for functionality? Am I looking for both of those options? What should I be paying attention to?
Well, I think a little bit of everything. You're going to want a system that provides a high level of service and tools and features for both the broker and the group and employee side. We've seen some exchanges that can be pretty one-sided. They have some great tools for the customer, but they don't really factor in the broker relationship, or conversely, those that are for the broker, but they don't provide much in the way of customer support and enrollment educational tools, which ultimately drive the group and employee satisfaction. I think it's important to find a balanced platform, one that supports the broker relationship, which I think is critical, and that provides tools for HR and employees to manage their benefits and answer the many questions they'll have during open enrollment.
Now, are you guys, can you represent is there a certain employee life size that you prefer to work with, or can you work small, medium, large employers?
Our platform supports all group sizes, and what's really unique about ours is that we allow the brokers to upload their own carrier plans and custom plans that they may already have a relationship with a certain carrier, or they can select from our standard plan. So we have relationships with insurance companies, and they don't just have to use one carrier's plan.
How are you helping your brokers and employers understand how private and public exchanges may work together? I think there's a lot of confusion there around the subsidized employees and how employers and their brokers will work to manage those lives in conjunction with those that are for the private exchange.
I think the educational tools are really important, and just educating the brokers and their clients, I think that really helps them. With the ACA, we're seeing so many laws and changes on a day-to-day basis, and it's just keeping your finger on the pulse and informing them so that they're informed as to how their business is shifting, and so that they can then be consultative to their clients.
Now, I know with Alissa, with the ACA, a lot of probably your traditional business, the ancillary benefits, that really sat on the outside of ACA and wasn't, affected too much. What do you see within ACA that might affect private exchanges in a good or bad way?
Well, I really still believe that employer groups are going to continue to retain and attract top talent through their benefit offerings. Over 90% of large employers offer dental coverage, and that number continues to rise year after year. I firmly believe that ancillary benefits will play a key role in the employee compensation package. I think brokers can create a powerful proposal for their clients by offering dental benefits and dental coverage, because it remains the employee's most desired benefit after medical coverage. To speak to what you asked about ACA, they do require the pediatric dental essential health benefit, but that can also be fulfilled by a standalone dental plan, such as our dental plans, as they do meet that EHB. I see that some medical plans can embed the pediatric dental EHB, but it doesn't cover adults, and even those who are looking for a plan for their children may want to consider fulfilling that pediatric EHB with a true family standalone dental plan. They'll most likely get a more robust plan and definitely more bang for their money with features such as ortho and periodontal care.
How does the private exchange market via brokers impact a broker's compensation package?
I think did you say the private exchange?
Yeah. I'm a broker working with a private exchange. Does it, what impact is it going to have or not on my commission model?
I think a lot of the private exchanges, at least the ones that are broker-centric like ours, are really factoring the broker and their business first and foremost to help them remain competitive and keep that source of income. We certainly created ours to account for broker commissions and to account for their compensation, to ensure that they have a sustainable business model throughout healthcare reform.
Yes, that's a big education part on your behalf to brokers, because I think there's a confusion factor out there with many brokers that really don't understand that right now.
Yeah.
Alissa, I think, if you were to look into your crystal ball and look out to 2015, 2016, what do you see the private exchange marketplace looking like?
I do think there's going to be, and I've heard some debate as to whether or not it's going to shift to a more business-to-consumer or business-to-business model. There's some healthy debate on that topic, but I think regardless of what side you stand on, the reality is that employees are going to be making benefits decisions very soon, and they'll likely take the driver's seat in selecting the right products for their needs, starting with the carrier down to the plan. And both brokers and employers alike are definitely going to need to start offering more educational tools and support to assist the enrollees with these decisions. Whether you're a broker or an employer, the benefits of offering that support will lead to increased employee and client satisfaction, and I believe there's certainly a tangible value to that.
Now, when you look at inside of your exchange, are you guys getting RFPs from solution providers who wish to be inside your exchange? How does that process kind of work? Do you go source the solutions that are going to sit inside your exchange, or is somebody coming to you to?
We've actually had a little bit of both. When we were first developing our exchange and going through the data collection phase and figuring out how we wanted to structure it, we certainly reached out to carriers who we wanted to partner with to be on our exchange. And recently, when we went to some of these trade shows to launch the product, we were approached by several other partners and vendors who wanted to embed certain aspects of their business into our exchange.
So part of, I mean, there's a lot of movement with transparency. To have ultimate consumerism, you've got to have transparency in the system. And there are some very, strong emerging transparency players. Are you including transparency solutions as part of your exchange experience?
I do believe that consumers want the transparency, especially with healthcare. I was just reading a Washington Post article yesterday, and it cited a Carnegie Mellon study, and it found that only 14% of the participants actually understood basic insurance features such as deductibles, copays, and coinsurance. And these are the people that considered themselves the primary or even secondary healthcare decision makers in the family. As consumers, we're really in tune as to what's important when making online purchasing decisions. When you buy a car, you know the features that you want. You understand what you're buying. Yet as consumers, we're really not that savvy when it comes to selecting healthcare and insurance products. And that's where I think that transparency comes into play. Especially with the emergence of private and public exchanges, many individuals are being moved from that handheld consultative open enrollment experience with a broker or HR to support them. And now they're having to make these decisions in a self-directed manner. And they're really used to having that support. So I think providing solutions like we have, such as educational videos and tools and creating a very health-literate website is really key to creating that transparency and making the customer feel like they understand what they're choosing and they feel empowered to make those decisions themselves.
What do you see wellness as part of an exchange environment or not?
There's a lot of data out right now that's showing the impact of every aspect of health, whether it's the oral health correlation to heart health and diabetes, to how all of these medical plans tie into one another, and I think that's important. I think wellness and having the consumer understand that it's not just a medical plan, not just a dental plan, but it's overall health and how each of those fits into that will really help them make a more educated decision for their family.
Now, Alissa, we got a couple minutes remaining on the program. Kind of what are one or two takeaways that you can provide to our audience on if I'm looking at an exchange, if I'm an employer or if I'm a broker out there, what are the takeaways that I really need to know?
I think it's important to find a balanced platform, one that supports both the broker relationship, which I think is critical, and as well as one for HR and employees to manage their benefits. Of course, data and security is critical, so partnering and aligning with a company that understands HIPAA regulations and securities. As an insurance carrier, we're governed by all the state and federal regulations, so our exchange was built with some of those features already. They're naturally programmed into us. But I think for the consumer side, I think educational tools are key. I do believe in creating an authentic and human online experience, especially when you're being moved from that very personalized experience to an online platform. You want a system that provides you with the tools to make the decisions comfortably and presents it in a manner that is relatable and understandable to most consumers. And
to end here, can you kind of give what is the website the audience can find you guys at?
It's www.solsticemarketplace.com.
All right, Alissa. Well, we really appreciate you having you on the program this morning, and have a wonderful weekend. To the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.
Hey, good morning, and welcome to this week's segment of Healthcare Consumerism Radio. This is Doug Field, CEO of the Institute for Healthcare Consumerism, and joining me this morning is my managing director, Brent Basie. Good morning, Brent.
Good morning, Doug. How are you?
I'm pretty good. We've got our co-host Ron on a plane to Alaska today. He's going up salmon fishing. So.
Yeah, lucky guy, huh?
Yeah, good for him. Well, we've got a busy program today, and I think starting this news and views, we're going to focus on our IHC University webinar series. We've got one coming up the 22nd of August where Ron will actually be talking about all the elements of healthcare consumerism, and sponsored by AFLAC. But the one on the 29th at 1 o'clock that I think the market's going to be really excited about is a sponsored webinar from Allegis, and leading the discussion in that webinar will be Terry McCorvey, president of Allegis Healthcare Marketplace. And Terry's with us this morning. Good morning, Terry.
Good morning, Doug and Brent. How are you?
Doing well, Terry. How are you?
Doing well.
You keeping up with You're probably busy, like I said, one-arm paper hanger, I guess, like they say, right now, getting ready for fall.
It's funny. Friday rolls around every week, and I think, man, this week's gone. And then the next week's gone even faster. But it's fun.
Yeah.
It's great to be in the middle of this whole consumer-directed movement and seeing how it's taken off. And, just really exciting.
Yeah, it's a lot of disruption out there, and a lot of it really got to be caused by private exchanges. Terry, tell us a little bit about, we've got this webinar coming up on the 29th at 1 o'clock, where you and your team are actually going to unveil some research. Can you give our audience kind of a sneak peek as to what they can expect?
Sure. Just finished it. It was done during the June and July time period. Mm-hmm. I interviewed about 500 HR people, employer sizes 50 and up, all over the country, and actually surveyed the HR people who are in charge of deciding what benefits are going to be offered. And as other surveys have shown, there is this groundswell movement from defined benefit to defined contribution. Mm-hmm. 60% of the HR people that we surveyed said, that they were familiar with defined contribution. And even more surprisingly, of those familiar, 90% said they were going to take a good hard look at changing from a defined benefit model to a defined contribution. So it's just further evidence that this movement toward a more retail consumer market is happening. It looks like 2015 could even be the tipping point where, we've got a ton of employers moving in that direction.
Now, Terry, was this something that were you expecting these kind of numbers? What were your expectations kind of going into the study?
We'd seen some other surveys, but the last survey I saw was about 9 months old, and I think what we're seeing is we're just kind of going down the continuum. Yeah. Where more and more HR people are discovering the benefits of defined contribution. And, the other thing we discovered, while the HR folks saw a lot of benefit in defined contribution, things like helping consumers make more cost-conscious benefit decisions, allowing the employer to offer a wider array of benefit options, giving employees a better understanding of what they're actually selecting, and obviously for the employer being able to come up with that defined budget. But the thing that struck me is there's still a lot of misconceptions. Mm-hmm. A lot of HR people still think that to do defined contribution to a private exchange, you've got to have individual-based health insurance policies. Mm. And as we all know, that's not true. Individual products can work, but, many insurance carriers are more comfortable in a group setting, right, offering group-based policies through the exchange. The other thing, just to wrap up on that quickly, is a lot of employers still think defined contribution and private exchanges are only for larger groups. And, we've cut our teeth over the last 15 years doing these contribution exchanges in the small group market.
Yeah, I think so. Go ahead, Terry. I'm sorry. Didn't mean to.
No, just it's not just for larger groups. In fact, I think the pain point may be larger in the small group and medium-sized group market than it is for the larger groups.
Ron and I talk a lot recently about, and there's been some research come out lately that it is going to reside primarily in the small to mid-sized groups, and I don't agree with that either. I think it's going to transcend across all employee sizes, and I think your survey is actually pointing that out. And I think the market's got a comfort level with defined contribution. While although healthcare is different than retirement planning, look what happened with defined contribution and defined benefits on the retirement plan side. I mean, there's tremendous adoption, and now 95% of the plans are defined contribution, retirement plans. They're not defined benefit plans.
Yeah. One of the other things that we've heard about with healthcare reform and moving to a new market is the broker going to continue to be a vital part of the benefit solution. And in our survey, really, I think in this year it was a little bit surprising. 66% of the HR people surveyed said yes, their broker and their benefit consultant were their absolute primary source for getting expert benefit recommendations. Mm-hmm. And so it just says, those brokers and consultants who are out there really adding value, I think are going to continue to be part of this chain.
Terry, do you see the brokers and consultants, are you at Alissa, are you guys fielding a lot of questions from the brokers and consultants, on how they can offer this to their clients, or what's kind of the feedback from the broker market?
We are. We're actually standing up private exchanges for some brokers around the country, mm-hmm. Their own private branded exchange, but many brokers are seeing private exchanges and defined contribution as a way to help them automate the servicing of smaller and medium-sized clients. Mm-hmm. And if you look at a book of business for a broker, there's a lot more small and medium-sized groups in that book than there are the really big ones. And, the days of them being able to go around town and attend all the open enrollment meetings are probably coming to an end just because the commission structures continue to be compressed.
Sure. Mm-hmm.
So the private exchange and defined contribution gives that broker the ability to plug into, the automation and the technology that they might not be able to afford on their own.
That's a good point. Very good point. I believe this fall is going to be a very kind of groundbreaking time, with you and many others implementing your private exchanges with employers. I think that, fast forward to December, January of this year, and we're pretty excited about IHC Forum December 5th and 6th, and I know you'll be a part of and be present with us. I think there's just a lot of wait and see, and as they hear it working, I think you're going to hear a giant sucking sound, to your point, into 2015.
Yeah, if I had $1 for every time I heard from a potential client, can you have me up and running by October 2013 so I can get that January 2014 enrollment?
Yeah, uh-huh.
I mean, that's it. You're right. That's the, but I always remind people that, number one, there's going to be a January 1st, 2015.
Yep.
And number two, there's a lot of groups that don't enroll in January. So, the capacity to have everyone's exchange up and running January 1st, 2014 is just impossible. But over the next 3 years, we're going to move in this direction more and more every year.
Terry, are there any challenges that you see right now to the private exchange market? I know, there's a lot of opportunity out there in the market. Are there challenges that you see that brokers are going to have to understand, and what are there potential challenges that you see out there?
Yeah, I think the broker has to enter into a new mindset that the broker is no longer going to walk into an employer with a spreadsheet of benefit options, because in reality, that spreadsheet of options already exists in all of the products that are on the shelves of the private exchange. Mm-hmm. And the narrowing of that selection is actually done consumer by consumer based on, their individual situation and their individual answers to the profiling questions. So really now the broker is working with the employer for that value add piece to help the employer understand this defined contribution model and how it allows the employer not only to give a better selection of benefits to their people, but for the first time really to have some ability to control the spend as the employer on benefits. The other challenge, these things, don't happen by magic. Mm-hmm. And when you've got a lot of different benefit partners, the technology piece is always a challenge because different carriers have different abilities when it comes to, connecting to a technology platform solution. But that's all behind the scenes. Once that's finished to the consumer, it's an easy, seamless process.
Hey, Terry, coming back to the survey, did your survey touch on asking the HR benefit team members what they would like to see inside the exchanges. The complete benefit experience, or what kind of products and services they'd like to see there beyond major medical.
We did.
Mm-hmm.
Number one, we said, what in your mind is the ideal exchange?
Mm-hmm.
And 68% of them said they wanted to see a wide range of carrier integrations.
Mm-hmm.
They wanted to include in a seamless solution the ability for their employees to manage their CDH accounts,
mm-hmm.
whether it be a health savings account or a flexible spending account or parking and transit or dependent care, to actually have that available as part of the private exchange solution. They really wanted integration with their payroll processing system,
yep.
so as consumers outspent their defined contribution and went into payroll deduction, there was an integrated way of loading that into their payroll system. And then finally they said COBRA compliance was important, because if the exchange is the central data point for eligibility maintenance and processing of coverages and billing, it only makes sense when a new hire is added or a life event, change happens, or termination, that the exchange fires off the appropriate information to be able to send out those COBRA notifications.
Well, Terry, we really appreciate you having you on the program, and today to our audience, Terry and his team is going to be back throughout the next couple months to release more of this information on the study that they did do on private exchanges. And Terry, again, thank you very much for joining us today on the program. And to our audience, stay tuned for the next segment of Healthcare Consumerism Radio.